name is Dr. Gerald Chodak. Yet another treatment for localized prostate cancer is a different form of radiation called proton beam radiation. Proton beam radiation differs from the conventional photon radiation in how it enters and leaves the tissues of your body. The bottom line is the thinking that the radiation from proton beam will cause fewer side effects to the surrounding tissues or less damage to the surrounding tissues than the conventional photon beam therapy. Now that's the theory. It's based on experiments, but it's not based on real data that has been obtained from patients. So where do we stand? Well, the greatest experience comes from Loma Linda, California, where they've treated many patients for up to 15 years. The number of patients followed long-term receiving proton beam only is rather limited, and the long-term follow-up is rather limited. In one of their reports published a few years ago, they reported up to good 5-year data of PSA failures. And the problem, of course, is that PSA is not a good determinant of how patients will survive long-term, whether their cancer will recur, whether they'll die from prostate cancer. So the information available about proton beam therapy is just very limited. And at the present time, there is no way to say, is it as good, better, or worse than other treatments available where we have 10 and 15-year overall survival rates. So that's one of the limitations. Another limitation is we don't have answers from patients filling out questionnaires who report the actual side effects. What's the effect on their quality of life, their impotence rates, their incontinence rates, in documented ways that would allow us to say, look, if we compare proton beam therapy to another therapy, here's how they look, here's how they compare. So, is it an option? Sure, it's an option, but it's an option that has much less information that's mature about it. So when you're weighing your options, you have to take that into consideration. Now, presently, there are not a lot of sites in the United States that offer it, although that number is growing. So if you live in an area where it's not available, the question is, should you visit and travel to one of those sites to get your treatment? And at the present time, we have no reason to believe that it is better as a treatment option than the other forms of radiation available using the current state of art, which we call IMRT for conventional radiation. It would be nice if we had some comparative studies, but it is unlikely that those will be forthcoming anytime in the future. So much in the way that HIFU therapy doesn't have long-term survival to compare it to other treatments, we don't have long-term survival treatment or long-term survival results available from proton beam therapy either. So it is something to take into consideration when you're weighing your options. If you're going to undertake this, make sure you try and find out as much as possible about what are the complications, how many men that were potent became impotent at 1, 3, and 5 years, how many men had problems with urination, how many men had problems with bowel function. These are questions that are not answerable yet. I can't give you good data to provide that information. All I can tell you is these are the questions you need to find out about. Ideally, in the future, we'll get more information about proton beam therapy, and maybe it will indeed turn out that it does have advantages over the conventional therapy. But until we have good data available, it's really not possible to follow the ads that say better results, fewer complications. There's just no scientific proof that that's true or false. Hopefully this information will be helpful to you as you weigh your treatment options. Thank you.